Hi everyone, Morgan Zaretsky here of Naturessence Personal Wellness Coaching, where you can go to learn the 7 nature steps I use to get off antidepressants and learn to love my life. So if you like this video, please go to www.naturessence.org where you can read all about the 6-step 90-day program that I have created for you there. But for right now, I want to share with you a article I found from the Journal of Clinical Nursing, and it's called Rethinking the Intensive Care Environment, Considering Nature in Nursing Practice. So this article is about how the Biophilia Hypothesis can act as a framework to facilitate more holistic nursing care for patients in the intensive care unit. And if you didn't watch one of my earlier videos where I explained the Biophilia Hypothesis, what it is in 1984, a biologist named Edward Wilson published the Biophilia Hypothesis, which described human innate tendency to focus on life and life-like processes. The concept of biophilia explains the innate human affection for, and importantly, our need to have nature in our daily lives. This need is not only for pleasure, but is also a biological need. So patients in the ICU, or intensive care unit, are constantly being disturbed or woken up by noises, which can put an additional stress on patients as well as contributing to sleep deprivation, causing all kinds of other complications, and essentially prolonging their stay in the hospital. What they found was that playing nature sounds can counteract some of these ill effects from excess hospital noise. 2 Iranian studies played nature sounds to their patients through headphones, and they found a statistical significance between the physiological, psychological parameters of patients who listen to either sounds of bird songs, soothing rain, river streams, waterfall sounds, or a walk through the forest, compared to patients who didn't listen to nature sounds. The intervention group demonstrated lower anxiety, agitation levels, with a reduce in blood pressure and heart rate over the intervention period. I'm going to switch hands here, sorry. They also found that exposure to natural sunlight was very beneficial. Patients who were exposed to more sunlight took less time to wean off of mechanical ventilation, and the more intense of the sunlight they were exposed to, the shorter the weaning time was. Exposure to light increases serotonin levels, which naturally elevates your mood, as well as exposure to natural light maintains our circadian rhythms, which is all connected to production of melatonin, corticosteroids, function of immune cells, our sleep-wake cycles, sleep structure, and immune response. So basically, the inclusion of nature-based items helps to soften the sterile environment that a hospital usually has, and reminds patients of and the staff of the world outside of the ICU unit. So obviously they're not saying that this is the most important thing in an ICU unit, as patients are obviously very, very sick, and the treatment there may be saving their life, but it also may be prolonging their stay and making it more miserable. So this paper points out some very interesting facts about the inclusion of some biophilic elements, which may help to ease their stress, make their stay more comfortable, and contributing to that, perhaps make it shorter. they're not saying that necessarily hospitals need to invest a lot of money into new equipment or redecorating or whatever it may be. Perhaps just as simple as learning to use what you have, like lifting the shades during the day to let natural light in, or moving conscious patients so that they have the maximum view through their window of the outside world. Simple, individualized, nature-based interventions support recuperation, improve patient outcomes, and patients' and families' well-being. In addition, these interventions have been shown to reduce nurses' stress, so it's good for the patients and the staff. They end the article by saying, in conclusion, it therefore could be argued that ICU patients need a daily fix of nature, and that the biophilia hypothesis needs consideration within the ICU nurse's everyday practice. The biophilia hypothesis is particularly pertinent to the care of patients who have a prolonged ICU stay. These long-stay patients experience the quadruple burden of suffering from their critical illness and its therapies, while being exposed to the detrimental features of an ICU environment, while lacking access to the benefits of a nature environment for a long period of time. With changes in sedation practices, these are also the patients who are the most aware of their environment. Nurses, in an attempt to reduce the negative effects of the environment, need to consider the implementation of an individualized, nature-based intervention as part of the long-stay patient's daily plan of care. So that's my reading for today. I hope you enjoyed it, and please make sure to follow me on Instagram, Facebook, as well as you can see all my videos on my website at naturessence.org. So until next time, bye guys.